session. Good evening, viewers. We at Osteoporosis and Arthritis Care welcome you once again. Today's topic of discussion is know about osteoporosis. Globally, nearly 200 million people suffer from osteoporosis each year. It is estimated that worldwide 1 in 3 women and 1 in 5 men over the age of 50 will experience osteoporosis fractures in their lifetime. 1 out of 8 males and 1 out of 3 females in India suffer from osteoporosis. So, what is osteoporosis? How it occurs? Can osteoporosis be prevented? What are the treatment options for osteoporosis? So, let's have an answer of all these questions. Today, we have with us eminent orthopedician Dr. Hemant Kalyan from Bangalore. Dr. Hemant is highly accomplished consultant and head of the department at Manipal Hospital as HOD and consultant orthopedic surgery sports medicine. With over 30 years of experience, his expertise extends to various areas of orthopedics, including hip and knee replacements, fracture surgeries with minimal invasion, post injuries, and arthroscopic surgery. Dr. Kalyan's commitment to providing exceptional care led him to conceptualize and found the renowned outpatient facility OC Care in 2004. Notably, Economic Times recognized his exceptional contributions and featured him as one of the top 25 inspiring orthopedicians in India in 2018. Dr. Kalyan's surgical expertise at Manipal Hospital, Bangalore is unmatched, and he has more than 6,500 surgeries under his belt. His wealth of knowledge has been shared with the world through 87 guest lectures in various national as well as international conferences. So we are very lucky to have him on the board. Thank you very much, sir, for your time. Over to you, sir.
Thank you very much for the kind introduction and welcome to this session on osteoporosis. So the whole purpose of this session is to spread awareness about this important condition. We'll give a little overview of what is normal bone health and how the physiology of the bone works, how it is altered when a person has osteoporosis, how big is the problem worldwide and in India, how do you go about diagnosing it, what happens if you get osteoporosis, how do we treat it, and then do a little summary of what has been covered as part of this talk. So let us start with what is normal bone and how does it work. So bone is actually a mixture of proteins, calcium, and minerals, and it has different cells. So it's a living tissue. It has cells which actually form new bone, cells which break down old bone, and which withstand mechanical stresses. The bone is not a static tissue. It undergoes constant remodeling. This remodeling occurs right from birth up to death, even if you live up to 95 or 100. So at any point in time, bone is renewed, new bone is formed at any given point, and the old bone is removed. And normally this is perfectly balanced so that you get a healthy bone. So this is how it happens. You have the osteoblasts, which form the new bone, and then the process continues like that. Then you have osteoclasts, which take away the old bone. That gets filled in just like you fill in a road, and then you get the new bone again. So this cycle continues throughout life. Now, in a normal person, male and female, the peak bone mass, that is the amount of bone in our bone bank, is maximum at the age of 18 to 30. And this is a combination of genetics, which is 75% of our bone mass is determined by our genes and contributed to by nutrition, by our lifestyle, and by the hormonal status of our body. Men have more bone mass than women by gender, 30% more, and different races like Africans get 10% more bone mass as compared to people like us. Now, what happens after menopause in women is that the osteoblasts, which take away the bone, because of decrease in the estrogen, will remove more bone, and the amount of bone which is formed is less. So there's an imbalance between how much bone is taken away and how much bone is lost. This results in weakness of the bones. So there is net bone loss. It's like a bone bank. We are spending more than what we are earning. So 0.5% of bone loss occurs every year by the time a woman is in her late 30s. And this increases to 3% per year in the 7 years post-menopausal. So after menopause, 7% bone loss happens every year, and then that slows down to 1% thereafter. So there is a continuous bone loss. So you can imagine if your peak bone mass is high, you have more money in the bank or more bone in the bank, so you can afford to lose some more. So peak bone mass is important because this bone loss happens in every woman. So if you look at the gender differences between men, which is seen on the red, men, you find that higher bone mass is attained, and then there's well-defined menopause in men, but as you become older, you get age-related bone loss at a lower rate. In women, the peak bone mass is lower, and at menopause, there is a sudden sharp drop and then slow decline thereafter. So what happens in osteoporosis? Osteoporosis basically affects the entire skeleton, and the bone at a microstructural level begins to deteriorate or become brittle. This brittle bone makes it more vulnerable to fracture with minimum injury. So an elderly lady at the age of 85 who's frail may just simply get up from a chair and break her hip, or she's traveling by auto for 1 kilometer. The auto goes over a speed bump and she may break her backbone. So if you look at the picture of what the osteoporosis looks like, you see the normal bone is so nice and dense over here. In osteoporosis, there are a lot of holes in the bone, air spaces. The bone has become fragile. In severe osteoporosis, the structure is obviously very weak. This happens mainly after menopause in women, and in men after the age of 75. As I said, there is no clear menopause in men. So there are basically two types of osteoporosis. One is the postmenopausal osteoporosis, and one is a senile osteoporosis. In postmenopausal osteoporosis in women, after the age of 50, they are more vulnerable to fractures of the spine and fractures of the wrist. Whereas as one gets older, beyond the age of 70, you're more vulnerable to fractures of the hip. So what are the risk factors for osteoporosis? First, as I already said, is gender. If you are female, the gender predisposes you. You can't do anything about that. Age is a risk factor. As you become older, you become more vulnerable for osteoporosis. Very thin-built individuals, more likely to get osteoporosis. If you're Asian like us or Caucasian like the white-skinned people, more likely to get osteoporosis. Family history means more likely to get osteoporosis. Deficiency in vitamin D, calcium, lifestyle which is not adequate, cigarette smoking, alcohol, excess of coffee, tea, osteoporosis. If there's a previous fracture, that's a very important risk factor for osteoporosis. So let us say that a woman has her first fracture at the age of 55, she breaks her wrist. Second fracture chance increases 3-fold. Third fracture, 5-fold. Fourth fracture, 8. This is known as exponential increase. So every time there is one fracture, it is our duty to prevent the second fracture if we are the treating doctors. 86% overall increase in the risk of fracture. Now, there are other conditions like rheumatoid arthritis, thyroid condition, kidney disease, people who have had renal transplants, and certain medicines which can cause osteoporosis. Steroids are the ones which cause osteoporosis very significantly. Many people have taken steroids for a long time for different reasons, like following renal transplant, following for the treatment of asthma, not so much used nowadays. People who are on long-term anticoagulants, blood thinners, people who are on drugs like methotrexate for rheumatoid arthritis, antidepressant drugs, all can induce osteoporosis. How bad is this problem? Osteoporosis is the commonest bone disease in the world. So it's a very common condition. It is the second largest health problem in the world after cardiovascular disease. Just imagine it. After the age of 80, 50% of all people alive have osteoporosis. That's huge. 1/3 of women and 1/5 of men above 50 years of age will have osteoporotic fractures. 1/3. Imagine, Indian population 1.4 billion plus. Out of that, above the age of 50, take 40 million. Out of 40 million, 1/3. Huge number. In women, osteoporosis affects almost half the women above the age of 50. And the risk of fractures is more than the combined risk of all cancers put together, breast, uterus, and ovary. So it's a huge problem. In Asia, the risk of hip fractures is small, but the risk of spine fractures is equal to the worldwide risk. And it is estimated that 50% of the total hip fractures in the world by 2050 will occur in our continent. That's a huge number. What about India? Our total population is now 1.4 billion, not 1.3. Hip fracture per year, 163 per 1 lakh women. So we have 26 million osteoporosis women in 2003, increased to 36 million in 2013. And by 2050, we expect that almost 33% of our patients will have osteoporosis above the age of 50. And as we become closer to 2050, our population will also be aging. So we'll have more older people, more osteoporosis. If you look at the unique features in India, Indians have more chance of osteoporosis compared to whites, and the fractures occur a bit earlier. Osteoporotic fractures is a huge burden on the family and a strain on the healthcare system, and decreased mobility causes a great psychosocial problem in the aged. So how do you diagnose it? One of the things that people will say is that, see, my grandmother has become shorter. That is, the loss of height is a very important factor because of spinal deformity, silent fractures of the spine, which leads to loss of height. That is how it looks like on the X-ray. An objective method of testing is by bone density. Bone density is done best by a DEXA scan. And in DEXA scan, we will determine the bone density of the person compared to the person with peak bone mass of the same race. That is, 20-year-old Indian female will be compared to, say, 60-year-old Indian female. And then the second comparison is between 60-year-old Indian female with 60-year-old Indian female. So same versus same, and same versus peak bone mass. According to WHO, if you have score below -2.5, you have osteoporosis. So this will be interpreted by your doctor. Bone mineral density correlates very well with fracture risk, and that is the way we can measure osteoporosis. As I told you, it's an exponential increase. So we have to understand that bone density and bone strength is not the same thing. Bone density depends on many things, not only the actual measured density, but how much mineral is there in the bone, and also what is the architecture of the bone, what kind of cells form it. So there's something called bone quality. Bone strength is equal to bone quality plus bone density. The quality of the bone plus the density together equals bone strength, and bone strength is the one which prevents fractures. There are certain lab things which we need to do to diagnose osteoporosis. Check the calcium, vitamin D, and rule out any other endocrinological problems. What happens in osteoporosis? The most important thing is that we want to prevent fractures because fracture can occur in the elderly very easily because the vision gets impaired, the muscle strength gets decreased, their reaction time is slower, they have problems with cognition, that is, they get disoriented, they may be taking multiple medications. And a number of people above the age of 85, 30% of females above the age of 85 will fall at least once a year, and some will fall more than 2 times a year. 6% of these falls result in fractures. So it's a huge, huge burden of fractures occurring not because of a road accident or some high velocity injury, but just because of a simple fall in the house. So the major osteoporotic fractures are of the wrist, of the spine, and in the hip. And the hip fractures occur in older people. The wrist fractures occur in younger people. When we are talking younger, means in this age group younger, 55 to 60 age group. Osteoporotic fractures are a very devastating problem. Hip fractures, up to 36% of people who have hip fractures in the elderly people will not survive more than 1 year. So it is a very, very serious condition. And only 1/3 of people who have hip fractures will be able to perform all their activities without restriction. 20% of people with hip fractures will never walk again. So it's a really serious problem. Similarly with spine fractures. This is a famous sculpture which shows how a patient with osteoporosis looks. You may be having a close relation at home, your mother, father, grandmother, wife, auntie, uncle, somebody whose back looks bent like this, or not. If not, you may have seen it in a neighbor. Very disabling condition. The good news is there are a lot of treatments available for fractures and for osteoporosis. So the one thing is to prevent fractures, start young, maximize the peak bone mass. So encourage young children to take up physical activities, avoid smoking and alcohol, lead a good quality life so that you get a peak bone mass, which is really good. More bone in the bank, good thing. Lifestyle modifications I spoke about. Prevention of falls in the elderly by not having loose foot mats, installing grab bars in the bathroom, making sure that those who have got impaired vision get cataract surgery or whatever is required to correct their vision, and reduce the unnecessary medication so that they don't get confused. Now we have so many options of medicines for osteoporosis. All osteoporosis treatment, we have to give calcium and vitamin D because this is the substrate, the building blocks for the bone. The basic treatment for osteoporosis is to reduce the rate at which the bone gets lost. So we give something called as anti-resorptive medicines. Anti-resorptive medicines are medicines which reduce the bone loss. And among this, the biggest one is the bisphosphonates, which I'll talk about. And then there are groups which stimulate new bone formation as well. So calcium, vitamin D is for everybody. How much calcium do you need in a postmenopausal woman? 1 gram per day, because only about 30 or 40% of it gets absorbed. Vitamin D, you require 60,000 units per month or 2,000 units a day for good quality bone. Vitamin D can be obtained from sunlight is the main source. Diet is not a great source of vitamin D. So 2,000 units per day or 60,000 units per month is recommended. Vitamin D not only builds the bone strength, also builds the muscle strength, reduces aches and pains and risk of fall. Anti-resorptive medicines, the ones which will prevent the bone loss, very, very crucial. So these will basically inhibit the osteoclasts which take away the old bone, and this results in less bone loss, same bone formation, net loss is prevented, bone density improves. There are various types of them. Some which can be given orally every week, some which can be given orally every month, and some which can be given intravenously once a year. The problem is that they don't get absorbed well, so they need to be taken in the morning before breakfast with 2 glasses of water. And there are different doses, as I mentioned. Some people with it get a little bit of heartburn and stomach irritation. So the main problem, many of the people, because osteoporosis is a silent disease, they do not take the medicines regularly, they forget, and there are various ways on which you can remind yourself in our new digital India. So start with the therapy soon after the fracture to prevent the second fracture. We spoke about different types of bisphosphonates. How long to give it? 5 to 7 years. And the good news is after stopping the medicine, it remains active. The drug remains active for another 2 years. The recent medicine called denosumab is a very good medicine, which is also in that category of anti-resorptive. It affects not only the vertebral bone, but also the long bones. The good part about it is it is to be given only once in 6 months, does not require monitoring, easy, small subcutaneous injection, easily available, can be given by any nurse. And to remember, once in 6 months, you only need to set your calendar once in 6 months. It's easier, compliance is good, results are good. Calcitonin is a nasal spray which we give sometimes after osteoporotic fractures for short term to prevent the pain of osteoporosis or reduce the pain. Estrogen used to be used a lot in the past. Nowadays, we don't use it so much for osteoporosis because there is a risk associated with breast cancer and with uterine cancer, which needs a lot of monitoring. So we avoid this as far as possible. There's another group of medicines called selective estrogen modular receptors, less commonly used, but useful in certain cases. We won't go into it in this talk. Then there is another medication which is called teriparatide, which is the only known medicine which forms new bone. So we talked about preventing bone loss by giving those bisphosphonates and medicines which stop the bone resorption. And then on the other side of the spectrum, we have teriparatide, which forms new bone. So new bone therapy is a really great thing, improves the bone geometry, increases the connection between the bone strength, reduces the risk of fractures, and it also reduces the back pain, improves that height loss. And the good part is that it is usually free of side effects, but it can be given only for 18 months to 2 years max and once in a lifetime. So if you go during the initial period, we will treat with hormone replacement therapy, not use much. And then we go in with bisphosphonates. And then whenever there's a fracture, calcitonin. And finally, teriparatide is the last and best treatment. So summary is, osteoporosis is a major health problem in India because our population is aging. Although we are a young country, we are also a country with an increasing aging population, may not be in terms of percentages, but certainly in terms of numbers. And by the time we reach the next 25 to 30 years, around 2030 or so, we'll have a significant amount of elderly people because the birth rate will fall and the death rate will decrease. So our people will live longer, they'll naturally become older. And this becomes a silent killer, which is going to be a great problem for our healthcare system. So in conclusion, I would like to say that basically, when you get a fracture, the fracture is a symptom of the disease. The actual disease is osteoporosis. And whenever we treat a fracture, as doctors, we must treat the osteoporosis. Because if you don't do that, then we do lose the opportunity to prevent the second fracture. And that is a great missed opportunity. So with that, I would like to thank you. And that's a picture of the hospital where I work, Manipal Hospital, Bangalore, which I'm proud to be associated with. And I hope that you found this talk interesting and stimulating and helps you to, research further about this subject, do some reading on your own. And if you have any queries now, we'll be happy to take some queries. So thank you very much. And our team can unmute themselves and pass on any question.
Yeah, thank you very much, sir, for your very insightful session. As you rightly mentioned, that don't just treat the fracture, we need to treat the osteoporosis, which is very right as far as the Indian perspective is concerned. And we have got a couple of questions. First one is from the audience is, does yoga help in strengthening bones?
Yeah, I think that's a super question. And right now, recently observed the International Yoga Day. And what yoga, the main thing in yoga is that it is stretching based and isometric strengthening based exercises. So yoga improves a lot the core strength of the muscles. It helps to keep the spine upright. It keeps to the mobility in the joints very good. But as a treatment for osteoporosis, on its own, it's not enough. I would like you to combine yoga with walking. So walking is the simplest thing that you could do, about 30 minutes, say 3 to 4 times a week. Along with that, you do yoga maybe 3 to 4 times a week. And then also devote some time to light weight resisted exercises using some dumbbells or some resistance bands, because that will give you a nice combination of the benefits of everything. So you have walking, which is a weight bearing exercise, along with that yoga, which is a fantastic stretching activity and core strengthening activity and balance and coordination activity, which helps to prevent falls. And along with that, you do some strength training using weights, and that will give you a really nice balanced program, which will help to strengthen your bones.
Right, sir. The second question is there any lab test to diagnose osteoporosis?
Yes. So the main test for diagnosing osteoporosis is a bone density test, which is not a lab test. It is a X-ray based test where we have a calculated bone density of several hundred thousands of people. So we get an idea of what is normal for a given population, like Indian population. So we do the bone density test and do the comparison between your bone density versus with same gender, same race, person with peak bone mass at the age of 20, and person with osteoporosis, and person of your age group. Lab tests are done to rule out what is called secondary osteoporosis. So let us say you have secondary osteoporosis because of renal disease, because of thyroid problem, because of, say, anemia, because of liver disease. All those things can be ruled out by lab tests. So calcium, phosphorus, alkaline phosphatase, as well as vitamin D3 and parathyroid hormones are what we call the general bone metabolic profile, which tells us about the health of the bones, along with the bone density. And if you are suspecting any other reason, what is called secondary osteoporosis, then you have to do the lab tests which are relevant to the disease. Like, for example, if you have kidney problem, then you'll do the renal workup, and then you can find out, is this contributing to my osteoporosis? Then you have to work jointly with your kidney doctor and the bone doctor to see what's best for you.
Right. So that's it from the today's session, sir. Thank you very much once again for your valuable time. And in future also we will have this kind of session. So once again, thank you, sir.
It's been a pleasure. And I hope that it helps the people who have watched it. Thank you.